Does anybody know what is ARDS?
Ma'am,
Acute respiratory.
fluids collection
Not just
in
fluid.
the air sac.
Full form, acute
Respiratory
Distress syndrome.
respiratory distress
Distress syndrome.
syndrome. Okay. So there are few terms that you have to understand. Okay. So there's acute. Acute means
short.
very good. Short. Okay. Respiratory means
Involving lungs.
very good. Involving lungs. Okay. Distress. What do you mean by distress someone? What do you mean by distress?
Restlessness.
Problem. If I say
Problem.
something is distress, something is in the problem. And what is syndrome? Sign and symptoms. So many sign and symptoms. So this is your acute respiratory distress syndrome. Yes, so this is acute respiratory distress syndrome. Acute means in a very, very short period of time. Okay. Respiratory means only your respiratory system is being affected and involved. Distress means
Problem.
Syndrome means there are so many
symptoms.
other sign and symptoms associated with this disease. So this is what your acute respiratory distress syndrome. So when I say acute, what do you mean by acute? What is the time period to define acute?
Sudden or time period?
No, time period. So what is the time period that you say that this is acute?
Short term, like
what is the exact time? What is the exact time?
2 weeks, 1 week or 2 weeks. 1 month.
Acute.
I think 1 to 3 days or in a 1
1
day
hour,
or
even few minutes also.
No, minute you can't say. It happened in status asthmaticus. In minute the solutions. So acute means 1 week. The situation started within 1 week. Okay. So the situation started within 1 week. Okay. Time period is going to be 1 week. Next thing, 1 week of worsening of your respiratory symptoms. Okay. 1 week means like 1 week, the sign and symptom has worsening. Okay, it means that earlier the patient has some few sign and symptom related to the respiratory, but within 1 week, the sign and symptom worsen so much that the patient is having difficulty in breathing. Okay, your second word is it is bilateral opacity. Okay, when you see the X-ray of a patient, you will see in both the lung there is problem. So there is bilateral opacity. Okay. Third is your cause. Cause should be, listen to me everyone very, very clearly. The cause should be exclusively pulmonary. The cause should be exclusively pulmonary. It doesn't mean that, okay, I had my heart failure. Heart failure can also lead to your pulmonary signs and symptoms. But when I'm talking about ARDS, the cause should be completely pulmonary in nature. Okay, the cause should be let me give you one thing. Let me tell you very clearly one thing. When we learn about diseases, okay, for example, I'm talking about heart. Listen to me everyone. Amul, Priya, Rosaline, Subel, Govindraj. Okay, you need to understand one thing. Open your cameras, okay? And then let's talk about it. So, for example, if I'm talking about heart, so we have an organization which is known as American Heart Association. We deal about all the topics related to the cardiology. Okay, so they do research every time. They see like what are the other diseases are coming. So especially for lungs, there is a special organization which deal all the problems related to lungs. So there's American Association of Pediatrics. So there are so many other association involved. Okay. when I primarily talk about our lungs, so there are other signs and symptoms associated with lungs, like you're talking about pulmonary. So there has to be one organization who is talking about lungs. Okay, so it is the organization which recently have changed their guidelines. The guideline has been changed very recently. It is in 2021. I will show you the recent guidelines. Okay, which talk about ARDS. So there has been a change in the ARDS. Okay. Next, I said the cause should be pulmonary in nature. Third thing, there should be hypoxia. These are the four things that should be taken in consideration when I'm talking about ARDS, because ARDS is medical emergency in respiratory. Repeat with me. 1 week of worsening condition.
Yes, 1 week of
Yes,
worsening
ma'am.
condition.
1 week of worsening conditions. Bilateral opacity.
Very
Cause
good.
of pulmonary
In
nature or
nature.
Fourth thing is your
Hypoxia.
hypoxia. Okay. So
Hypoxia.
let me show you what exactly pulmonary means to you. Okay. Let me show you what pulmonary means. Okay. So I'm so sorry. The recent guideline has been changed in 2023. Okay, not 2000. So let me show you. So the recent guideline says that there are 4 criteria which you need to be linked. This is from the Journal of Club Acute Respiratory Syndrome. As you can see. Can you see this thing?
Yes, ma'am.
Yes, ma'am.
Saying the time up to 7 days. Arre, kya ho gaya?
Can we
Okay,
take a
up to 7 days. Can you see the first thing is up to 7 days? The condition has been started worsening within 7 days. There is pulmonary edema, non-explained by cardiogenic edema or intravascular volume overload. It is just due to pulmonary nature. It has not been affected by any cardiologic reason or there is any kind of renal. You should know one thing. Okay, everyone look at me. When I'm teaching you about lungs, you should know that heart, kidney, lungs, these three go hand in hand. If one organ get affected, both the organs will get affected. Versa versa. Okay. So these are related. Okay. Next, radiological feature, bilateral infiltration of X-ray, lung ultrasound by trained professionals mean that there is bilateral opacity in both the lungs will affect it. The fourth thing, there is hypoxemia. You don't have to learn these values. And hypoxemia. Understood the 4 criteria? The
Yes,
recent
ma'am.
guidelines of 2023 state this thing. Okay. Now let me show you the better picture of ARDS. Okay, where is my lung? Okay, you need to see everything over here. Okay. Look at this right side. Okay, look at this right side. This is, if I'm making an alveolar, okay, alveolar. If I'm making an alveoli, yes, thank you so much. So, listen, the alveolar membrane is very, very thin. Can you see this is only made up of one? In the lungs, in the alveoli, there are 2 types of cells, type 1 cell and type 2 cell. The type 2 cells produce your surfactant. Okay, I want to teach you about surfactant. Does anyone know about what is surfactant?
It protects the
Farhad,
lungs.
Govind, Suban.
Protect the nerves.
Sorry?
It protects the.
No, I'm just asking about surfactant. Okay, tell me
It's a
one thing.
layer, ma'am.
Like it's like a surface active agents.
Yeah, more, something more. Okay, tell me one thing. Surfactant decrease the surface tension or increase the surface tension?
I think, ma'am, decrease.
It's in a break. You're going to study about more surfactant. And listen to me, I will tell you one thing. Okay. Do you know sometime when we're drinking water and mistakenly when we spill water on a wool, so this water particle collide with each other and make a small circles. Have you ever anyone experienced this kind of phenomena?
Yes, ma'am.
Someday
ma'am.
or the other, you must have seen, like when it just imagine in a velvet cloth. So when you spill water on a velvet cloth, it is not going to, it will be like the water molecules will form and they will not form small bubble, not bubbles, like filled with water molecules. Okay, this is called surface tension. Okay, this is called surface tension. Due to surface tension, the water molecules collide with each other and they did not get absorbed. So surfactant will decrease the surface tension. So that's why our body water molecules does not form up bubbles and easily, because listen, this is a very small cavity. Okay, so these cells are being there. There's water molecules. There is a small capillaries around this thing. Oxygen is carrying. So it can make small water molecules. So these type 2 cells, they act as surfactant and they prevent us. Okay, so this is the normal cell. Can you see? There is no cilia. Cilia is all over here. Can you see? These are the columnar cells over here. And there is squamous, very small epithelial layer. And there's only some 5, and this is very minute. So there is an anatomical change also. So there's one thing, there's macrophages are there, type 2 cell, and their alveolar spaces. Okay, let me tell you one very important thing. That is when there is any kind of injury to your alveoli, any kind of injury to your alveoli due to pulmonary nature, just for example, a patient got pneumonia, severe pneumonia. Okay, so what will happen? The bacteria got accumulated in this thing, in your alveoli. And when there is an bacteria, just imagine there is bacteria. Okay, there is an bacteria. Okay, when the bacteria will get affected by the, just imagine this is an bacteria. Okay, so when our immune system get along with the bacteria, so when our immune system recognize that this is a bacteria in my alveoli, they start doing inflammatory reaction. I understand one thing, in the later on my chapters, I will tell you more about inflammation. So you need to be very careful that what exactly happened during inflammation. So whenever there is a bacteria, just imagine this is a bacteria. So what will happen? Just imagine this is a bacteria. So bacteria will produce antigen. Okay, bacteria is an antigen for our body. So what happened? Our
Antibodies
neutrophils,
will produce.
macrophages, and this RBC, they will start coming to the location and they will try to eat this bacteria. Macrophage will try to engulf this thing. Okay, so this is eosinophil. So what will happen? Eosinophils further will release this interleukins. Can you see this? Leukotrienes, oxidase, protease. These are going to break down. Protease will decrease the protein, oxidase, protease, fibrin, interleukin, tissue necrossing factor, okay, neutrophils, interleukin 8, RBC. Okay, so these are, can you see, inactivated surfactant, and there are surfactant like water molecules over there, protein rich edema fluid, and they will
Yes,
start eating the bacteria over there, and they will protease, lipase, they will erode this because this is a very thin membrane. Okay, so they will affect the alveoli, and can you see this alveoli, and they will start hyaline membrane formation, and this wall get deteriorated. When this wall will deteriorated, there no further exchange of gases. Hence, the fluid will accommodate in your alveoli, and you will get infection as well as ARDS. So the sign and symptoms will get worse, like shortness of breath, everything will get worse. And there's a fluid in your alveoli. Understood? Should I tell you again what is actually happening? In ARDS, there are 4 things that you remember. Very quick, very acute, respiratory system acute, pulmonary occasion, okay? And there is inflammation in your alveoli. And in inflammation, there is always release of leukotriene, oxidase, protease, tissue necrosing factors, interleukins, okay, RBCs, your WBCs, your neutrophils, interleukins, neutrophils, and there's no exchange of gases. A patient will go in hypoxemia. So these are the sign and symptom associated with it. Understood, everyone? Okay. Can you tell me the sign and symptoms more?
Shortness of breath,
Very good. Shortness of breath will be there.
Dyspnea,
Dyspnea, yes.
Hypoxia, tachycardia,
Hypotension.
Yes.
tensions,
Hypotension. Tachycardia will be there.
yes, ma'am.
Yes. Okay. So these are the causes.
Yes, ma'am.
Now let's talk about what this is all you have then understood that the pulmonary should be the nature. Okay. What are the causes? First cause I told you can be due to pneumonia. Yes.
Yes, ma'am.
Bacteria came.
Yes, ma'am.
There is a fighting in your alveoli
Yes.
and this is all happened. Okay. Pneumonia can be.
Bacteria, debris,
Sorry.
debris, mucus, debris.
Debris. Yeah. Pneumonia. Pneumonia is
They are
Yeah,
also a kind of
sepsis.
pneumonia. They
Sepsis
are
can
also
be there.
type of pneumonia. No,
Yeah.
Causes of
sepsis will next step,
Abscess.
ma'am.
Yes.
When
Lung abscesses.
infection going to the blood, in that
Yes,
case, making a sepsis.
Yes, sepsis can be there. Abscesses, lung abscesses can be there. Cystic fibrosis can
growth.
cause.
Sharp,
Okay.
ma'am.
So these are the causes. Pneumonia, sepsis, abscesses, lung abscesses, cystic fibrosis. So they can call.
Mucus, fluids, debris.
Yes. Okay. Next, let's understand what other more signs and symptoms. So there could be absent of lung sound also. Absent of lung sound can be there.
Minor cause speckles.
Sorry?
Freckles, ma'am.
Crackles, yes, crackles.
Sound.
Crackle sound, yes. Okay. Can you tell me
Hemostasis
one-
in blood.
Sorry?
Hemostasis in blood. Clot.
Hemostasis.
Hemostasis
Non-cough.
in blood.
Okay. Immune, did
Cause
you? Yeah, I respect your thing. Did you
due
have you
to-
ever heard of virtual triangle?
Yes, ma'am.
Sorry?
Did you ever heard of virtual triangle?
Yeah,
Yes,
we
ma'am.
did the
Short
group.
Yes, ma'am.
triangle.
What is this virtual triangle?
It is something
Statistics of blood
coagulatory.
flow.
In order to make clot, there should be 3 things. What
Yes,
is the
ma'am.
first
Yes,
thing?
ma'am.
Thrombus.
Hypoxia.
Statistic of
Hyper
Blood status.
coagulation.
Blood status. It means patient is in coma. Okay. Complete bed rest. Second thing can be endothelial damage due to your smoking. Smoking affect your endothelial damage. What is the third factor which involves the clotting of your blood?
hypercoagulability of
Hypercoagulability.
Very good. Hypercoagulability. It means when a patient is taking tamoxifen. Did you heard about this drug tamoxifen? Estrogen, high dose of estrogen. So
Yes,
they
ma'am.
promote hypercoagulation. Okay. So you said mule did what did you say just now?
Hemostasis.
But why there is hemostasis? Can you explain me?
Because,
why?
ma'am, when patient having a hypoxia, in that case, in the blood produce a hemostasis, and then they will cause by ischemic stroke or a MI when clot going to be brain. In that case, they causes a severe ischemia. shortage of oxygen supply to the brain. If it clot going to be hard, and that case they
I understand your point, but can you explain me how hypoxia is causing blood clot?
caused by, madam, we can say that
Can't get out of TV.
due to respiratory failure, ma'am.
Yeah.
Hypoxia. Hypoxia is the main cause of hemostasis, I think so. Maybe
you
you know very well. I just say you.
You have to explain with valid point. I will understand, but you have to explain me. If you're saying that hypoxia will lead to blood clot, give me a valid point.
Yeah.
Because I think that these are the three factors which affect my blood clot. And
Actually, ma'am, these signs are leading that furthermore diseases like ischemia or ischemia
yes,
and
hypoxia
CVA,
will lead to
hemorrhagic, and
ischemia.
MI.
I'm not denying the fact that hypoxia will lead to ischemia of your heart, and eventually you can get heart failure or
I mean
brain
that.
stroke.
Yes.
And
Yeah,
oxygen.
this you will have it. Hypoxia is leading cause of all this thing. This is you can have. But you're saying clot. Then I have to read about it more, then I can come and answer you. Okay?
Okay.
It's
Okay.
okay. So I'm saying that one thing is important. So in ARDS, okay, did you understand the definition of ARDS till now?
Yes,
Yeah,
ma'am.
acute respiratory distress syndrome.
Yes. And there has to be 4 criteria that I've already told you. Did you
Yes, ma'am.
understand the sign and symptoms?
Yes, ma'am.
Yes.
Yes, ma'am.
Did you understand the pathophysiology?
Yes, ma'am.
Did you understand the cause?
Yes, ma'am.
Yes, ma'am.
Next and very, very